The following is an Operation Podcast production.
How do you get what you want in bed?
You asked for it. Yeah, so I'm going to talk a lot about erections. Keep that blood flow in, get that blood flow in. Sexual health is the ability to essentially have the actions related to sex. So that can be having sensation that feels pleasurable, having erections for men or clitoral tumescent for women, feeling aroused, and then being able to climax and feeling pleasure that way.
What is the most common problem you see most males currently experiencing when it comes to their sexual health?
Erectile dysfunction, by far.
What is the most common problem most females are currently experiencing when it comes to their sexual health?
Yeah, so number one is low libido. I don't think anyone taught me, where the clitoris is or what masturbation is, or, why boys didn't get to know why they're having erections randomly during the day or in the middle of the night, and why they may have wet dreams. None of these things were taught, right? And I think these are really important. We should know why our body does the things they do, because you can find that people may develop quite a bit of shame around things. Hi, I'm Rena Malik, MD, urologist and pelvic surgeon, and I'm here with Ever Forward Radio.
Well, Rena, it's a pleasure to have you on the show.
You.
I have so many questions. And to kind of preface this before we dive into all of the things, can you please walk us through briefly your professional expertise, background, credentialing, just to kind of set the tone for the audience?
Absolutely. So I'm a urologist, and a urologist is a medical and surgical doctor of the genitourinary tract. So that means the kidneys, the tubes that drains the kidneys, the bladders, all of the genitals, and for women also the uterus and the vagina and all those sort of genital organs. And so anything that goes wrong with them, particularly surgically. So we don't deal with the medical aspect of kidneys, but we'll deal with kidney stones, kidney masses, kidney tumors. And so that's what we do. And we can do anything in that area. So that can be cancers, that can be infertility, that can be kids, pediatrics, that can be women's health, men's health, a whole host of different things. And you can specialize in those. I did a fellowship in what's called female pelvic medicine and reconstructive surgery, now called urogynecology and reconstructive surgery, but basically take care of women's health and bladder issues. And then I got this interest in sexual health, which is what brought me to sort of start making content on social media about sexual health. And so now I'm an expert in that area as well.
You are. Oh, everybody buckle up. We're just going to go rapid fire, a lot of questions. So in general education, is there a difference between sexual health and reproductive health?
So sexual health is essentially it includes reproductive health, right? You can't have one without the other. But if you don't want to reproduce, then technically sexual health can be its own thing. So sexual health is the ability to essentially have the actions related to sex. So that can be having sensation that feels pleasurable, having erections for men or clitoral tumescent for women, feeling aroused. So that general feeling that you get when you have the desire to have intercourse, and then being able to climax and feeling pleasure that way. So those sorts of things, those functioning appropriately, and then reproductive health really surrounds being able to reproduce, so meaning have children. So that means that for urology, we focus on men's reproductive health, but making sure that they're producing enough sperm that they can have a viable pregnancy, that they can create a viable pregnancy, and making sure there's no issues in delivering that sperm to the vagina and subsequently to the fallopian tubes, where you're going to reach an egg and then have a baby. So there's sort of two different factors, but they're very interrelated, because things that affect reproduction may also affect the ability for a man, for example, to have a good erection. So if they're having low testosterone, they're going to have less sperm count, and they're also going to have difficulty having erections. So they do go hand in hand, but not everyone cares about both, right? If there are people who identify as asexual, so they may not care if they're having these sexual feelings of pleasure or enjoyment with a partner, but those are still sort of reflective of your overall health. So what I like to tell people is it's blood flow, right? At its core, a lot of what makes things work is having good blood flow. So when you don't have good blood flow to your genitals, that could be a sign that you don't have good blood flow elsewhere, like your heart or your brain. And so it's really an important measure of health, a biomarker, we like to say, of health.
I actually had this question posed last in this gen ed section, but since you bring it up, let's just go there first. Blood flow, what role does nitric oxide play in sexual health? I'm sure it does when you're talking about blood flow.
Yeah, so I'm going to talk a lot about erections because a lot of the data is in terms of erections, and that can be applied to women too because the anatomy is similar. So when you think about a penis, that's something everyone knows about, that you can see it, it's very obvious. But women, the analogous structure in women is the clitoris. So if you actually look at a clitoris in the lab and you cut it open, just like you'd cut a penis in an anatomy lab to look at it, the structures are identical. Like there's two spongy bodies, they're the same arteries and nerves running at the dorsal aspect of it. So they look identical and they work identically.
Doesn't it starts as the same anatomical thing in utero, right?
Yeah, it's called the genital tubercle. So it differentiates into either the penis or the clitoris. So back to your question about nitric oxide is like the ignition for an erection. So you need to have nitric oxide, which is released from blood vessels and nerves, which is in response to some sort of stimuli. So in order you see something, you hear something, you feel something that you feel is erotic or arouses you, your body will start releasing nitric oxide, which then sort of ignites that cascade to either engorge the penis or engorge the clitoris. So men get an erection and women get clitoral tumescence.
Okay, so when it comes to, again, staying on topic with nitric oxide, let's say we have poor blood flow, we're not getting erections in terms of frequency, intensity, or for women, we're not getting genital blood flow in that area. Is it always then related to nitric oxide, or can we always go to, if I work on increasing nitric oxide, I will also get the result I'm looking for in that area?
So it depends. I mean, certainly when you have less nitric oxide, or it's because there's a blood flow issue, right? Your vascular endothelium, or the lining of the blood vessels, is not healthy, right? And so the most important thing that I think people always overlook, like how can I fix this? Well, the number one thing you can do is get your blood vessels healthy. And how can you get those healthy? Diet and exercise, right? So that's number one before we start thinking about like, how can we manipulate the pharmacologic cascade of, can I take nitric oxide in some form? Can I take medication in some form that's going to help me? First, you got to work on diet and exercise, and then you can talk about the other things.
Is it as simple to we do the first things, the simple things? Well, diet and exercise aren't always simple for everybody, I should say.
The free things.
The free things, exactly. The lower hanging fruit. Is it just as simple as, I take a nitric oxide supplement? I know it comes in different forms, and I've heard various things from guests and the interwebs about how we can supplement with nitric oxide for this purpose. Yeah,
so nitric oxide boosters can help, but I would say that there's not a ton of data behind them. And the issue, I think, sometimes with the supplement industry is that there's not a lack of regulation. So sometimes what's on the bottle is not what's in the supplement. So I tend to say, yeah, you could try them. There are some supplements that do have been studied and show to increase nitric oxide.
What?
L-citrulline and L-arginine are the two. So L-arginine is a precursor to nitric oxide, and L-citrulline is a precursor to L-arginine, but it is more bioavailable. So very often L-citrulline you can take less frequently and get the same results. So those are ones that I say, in the data show some really pretty significant benefit in terms of boosting nitric oxide and potentially having improvements in erectile function. But you can also, so the medications that we use to treat erectile dysfunction, like sildenafil or tadalafil, brand name Viagra, Cialis, those work by sort of keeping more of the enzymes around that maintain erection. So basically they're preventing the breakdown of those enzymes that cause you to detumesce, and that's how they work. So you can, you can manipulate on different factors in terms of improving the ability to keep that blood flow in, get that blood flow in to the penis and maintain it. And so, so those are things that you can do. But again, I think a lot of people tend to skip over to doing those things rather than really taking a hard look at their, like I see men all the time who've not ever had their cholesterol checked, who've never had their...
No one in this audience.
Yeah, hopefully not, right? But you'd be surprised, like I'm healthy, I work out, and you look at their cholesterol, it's like through the roof, right? And so, or they've never gotten screened for diabetes. And so these are things like they're easy, you got to check and you got to make sure, and then you got to actually be aggressive about trying to fix them, whether it's through diet and exercise or other things. And then, and I still think you can use other means to help you. There's no problem with that. But I think if you ignore those other things, we're just putting a Band-Aid on a problem, right?
I agree. Yes, absolutely. I love beets. I eat a lot of them in my diet. I also recently started supplementing with a beet powder. Well, recently, meaning like at home, I have it, but for years, when I go get a smoothie, sometimes after a workout or before going into the sauna, I'll get it like a beet powder extract in a smoothie or a drink or something from the smoothie bar, because one, I just love how it makes me feel, but also I know that. Well, what I've seen is that it helps enhance nitric oxide natural production in the body, which makes me feel great after a workout or before a workout for endurance recovery purposes, but also before a sauna, just to kind of vasodilation and again, enhance recovery. Am I just feeling it, or is there actual truth there to beets and beet powder?
Yeah, so I don't know about the data on beets particularly. I haven't looked into that specifically, but I would say that, yeah, there's certainly a potential to improve nitric oxide with food. But, I think like we know, for example, watermelon has a ton of L-arginine.
Right?
L-citrulline. And so it's really high concentration. But if you look at the data on watermelon, you got to drink like 6 glasses of watermelon juice to really see the difference.
That's a lot of watermelon.
Right. And so probably the same with beets would be my guess, is you need a lot of it. And maybe those beets powders have enough. Maybe not. I don't know. And so, yeah, you might see a benefit. But again, I think like if you just eat a bunch of beets and you don't like do other things, but yeah, I don't think it's going to hurt you potentially to do that. And it may help. But I don't think it's a home run necessarily.
Yeah, personally, I just love the way it makes me feel.
Yeah.
And again, all the research I've looked at, it kind of, helps with, I'll just say mostly vasodilation. And so if we have that in general, it's not a bad thing, but especially again, for training, endurance and recovery purposes, I love it.
Yeah, no, and I think it's fine. I think some people need to be thoughtful. Beets do have a lot of, like they can't, if you're taking a lot of it, there is sugar content in beets. If you're diabetic, you have to, like, I think there's a fine line where people will start, like, for example, when people have UTIs, they'll drink cranberry juice, but cranberry juice, if you're buying like the juice and not the concentrated 100% cranberry, there's a ton of sugar in it, right? Yeah. So you got to be careful. Yeah.
Okay. So do we have an effective sex ed methodology in the United States? What's your take on that? And do you think there is a best method for sexual education right now?
So no, I don't think it's effective at all. I think we have very little time allocated to sexual education in the curriculum because there's just so much to teach. And I think that they focus on things that are important, like consent and sexually transmitted infections and how to put a condom on, but they don't teach people how the body works, right? Like, I don't think anyone taught me that, where the clitoris is, or what masturbation is, or why boys didn't get to know why they're having erections randomly during the day or in the middle of the night, and why they may have wet dreams. Like, none of these things were taught, right? And I think these are really important. We should know why our body does the things they do, because you can find that people may develop quite a bit of shame around things, and unintentionally, right? Like, they may be masturbating and their parent might say, "Oh, don't do that," right? And they're like, "Oh, is this bad? Like, I don't know." Right? And then that could be enough to make someone feel shame for the rest of their life, right? Around their genitals. And so, like, I think it's so important. And I think people just think of it as like this thing we should shove under the carpet, but it affects people's entire life, right? Like, I tell my patients, like, think about when you were younger, how much energy you put into getting a partner, right? How that consumed your thoughts.
Yeah,
like, everything you did was around maybe getting this partner to like you. And so now take that, and then you think about, well, maybe something's wrong with me. Maybe that's why people don't like me. And it's consuming your thoughts, and it continues with you as you age. And like, it can detract from work productivity. It can detract from the ability to feel joy and happiness, right? Like, there's so much that we're just ignoring. Like, if you're thinking about it too much, there's something wrong with you. But no, like, it's something that we can't talk about openly because society says we can't, or says we shouldn't. And so then you feel alone, and you feel like you can't talk to anybody about it.
Not anymore. Not up in here, at least. That's why we're having this conversation.
Yeah.
Okay, so I hear a lot of differencing of opinion. I see a lot of good science, bad science when it comes to sauna being good or bad for a lot of different reasons, but especially when it comes to our sexual health. What's true about that? What's not?
Yeah, so in terms of sauna, there's no data specifically on saunas. The reason that I think people get concerned is because it's raising the temperature, and testicles in particular for men the reason your testicles are in your scrotum is because they need to be a certain temperature. And that certain temperature is to optimize sperm production. And if it gets too hot, sperm production will go down. In fact, if you have a fever, your sperm production can go to 0. can go all the way to 0.
Wow. And that's just internally generated heat.
Correct.
Wow.
Correct. Wow. So the thought is that, okay, if you're exposing yourself to too much heat, are you doing damage to your testicles that may cause a problem with semen production? Now, I think we can extrapolate from societies like in Europe where they're doing sauna all the time, and they're
look at
still
Finland.
Right. Finland, they're doing sauna all the time, and they're not having a problem with birth rate, right? So probably it's not, right? Probably because most people are either naked when they're in the sauna, their testicles are not, being pulled up close to the body.
Wait,
so
should we be naked in the sauna? Is it better to have clothing? Or
it may be better to let the testicles breathe, right?
Really?
So that they're not getting even more heat from being close up to your
I'm
body.
going to get kicked out of my sauna next time. That's not going to go well in my gym.
Well, you can cover yourself, but you know what I mean? But there's perhaps, right?
Okay. So just, I'm imagining just being completely naked, but you're saying if we weren't wearing underwear or restrictive gym shorts or something.
Nothing too constricting.
So just like a towel.
Yeah.
Okay.
Yeah. So I think most people are probably wearing just a towel or something, right? Which is fine. And the testicles are probably splayed out more. They're not like up in close to your body. So probably it's okay. And I think, as long as you're not doing it to excess, like you're there for an hour every day, you're probably going to be fine. But we don't know. The data's not there to say like, okay, we followed this number of men for this many sauna uses and then check their semen analysis. That hasn't been done, although it should be. It seems pretty easy to do. But to my knowledge, it hasn't been done.
That kind of makes me curious. I recently got pregnant, and I've gone through a fertility journey as well. And for the last couple of years, I've done various forms of fertility testing. 3 times now, if definitely for sure twice, I've done an at-home semen analysis. And it makes me wonder about maybe running a test on doing it again. And because I'm a frequent saunaer, I go probably 2 to 4 times a week. And it ranges from traditional dry sauna to IR. And when I'm in the dry sauna, it's a public one. I'm at a gym, so I usually go after workout. So I am in shorts, usually with kind of like a liner, so a little bit restrictive. I'm hearing probably not the best idea. When I'm in another sauna, more private, I do just a towel.
Yeah.
So I'm curious about, running an at-home semen analysis test, run through my kind of traditional sauna protocol, and then see.
You could, you certainly could. But I think the interesting thing would be to see if we had like multiple guys and we actually had like a real study, to see, because one person's data, it'd be interesting for you, right? Because maybe that amount of heat is too much for you, but not too much for somebody else, right? Everyone's individual, but it'd be nice to see like as a whole, can we make a prescriptive recommendation, although I don't think that we're going to find that because otherwise we would have seen this big drop in birth rates in Finland when sauna use went up, right?
Yeah, true. Yeah, all right, so everyone watching the video, I'm going to do a live test call to action here. Drop a comment down in the video box, but I keep getting stuck between YouTube and podcast. So drop a comment in the box below if you'd be interested. I got a great at-home fertility test I'll share with everybody. If you already do the sauna, I think this would be cool to see a couple different people's approach.
Yeah.
And then what about cold plunge? Good or bad when it comes to sexual health?
Well, before we go on to that, I just want to mention that hot tubs are something we don't recommend if you're doing a lot of hot tubs.
Why is that?
Because you're submerged in the hot water. And for whatever reason, we do know that hot tubs, and that's something that we sort of do mention when people are trying to conceive, if they're having issues to avoid hot tubs. So, but back to your cold plunge question. Cold plunges, we don't know if they're bad, but we do know there have been some studies looking at testosterone after cold plunges. So the studies are not huge, and they're not specifically like you're cold plunging for the purposes of necessarily like it's usually like in the military, they're cold plunging for training and things like that. And they've seen that if you're cold plunging for long periods of time, you might see a decline in testosterone. But generally speaking, we're not seeing a bump or boost in testosterone, which makes sense because if you think about it, when you are, we know that cold plunging is not necessarily great for muscle growth, right? And testosterone is going to increase muscle growth. And so potentially,
It's so finite. Everything I've looked at, sorry to interrupt you, but just like if you are a professional bodybuilder and that is your goal is just hypertrophy day in, day out, you're definitely, kind of probably doing yourself a disservice. But honestly, what we see in the pro anti-inflammatory response, it enhances recovery, meaning reducing time and recovery so you can go train more. So it's so nuanced. So
it is nuanced, yeah. But generally speaking, when you look at the totality of the data on cold plunging, it does not show a boost in testosterone after cold plunging. So I doubt that it's harming you unless you're like cold plunging. Like one of the studies was like 9 hours of cold plunging with the military, with the military.
Oh, yeah, you're like bud training for the SEALs.
So in that particular group, it did decline testosterone, but they were in there for 9 hours. So like your testosterone goes down over the course of the day anyways. So I don't think it was a great study, but in general, like most of the studies don't show a difference. So probably you're not harming yourself and there's no clear benefit yet.
Okay. All right. Fair enough. Great. Thank you. Is it better to have sex in the morning or evening?
Well, it depends, of course, on your preference. Like there's no better, but in terms of your body physiology, testosterone is at its highest early in the morning. So if you get your testosterone blood work done, we generally recommend getting it done as early as possible before 10 a.m. because that's when you're going to see the highest level of testosterone. And testosterone follows this diurnal pattern. So it goes up during the day, slowly goes down, and then starts going back up and through the night until you wake up. And so generally you'll have more desire because testosterone is seen as the hormone of desire early in the morning. Now, does that mean your sex will be better? Not necessarily, but it just means that you may have more desire. You may be more receptive to having sex or more excited to have sex in the morning.
Yeah. Okay. And so let me reframe the question a little bit, and you kind of answered it, but to ask more specifically from a sexual health lens, let's say if we're choosing to be sexually active and we want to maintain or increase our sexual life frequency for the sake of keeping our sexual health up, is it better to have sex in the morning or evening?
So the most important thing is to maintain, at least for men, is to maintain erections. So that means that you should you should be getting nighttime erections, and that should be sufficient. Whether you're having sex or not, your body will usually have 3 to 5 nighttime erections over the course of the night.
Like while we're asleep?
While you're asleep. And that's basically a physiologic mechanism to keep blood flow going to the area.
Really?
Yeah. Yeah. So it is
the
actually.
body is so crazy. That's wild.
So yeah, it's basically maintaining your penile health by itself. So if you start noticing that your nighttime erections are going down, well, that may be a sign that there's a problem with blood flow. And so then generally recommend, you should try to do what you can to maintain erections. Again, we go back to the same things: diet, exercise, see your urologist or your primary care doctor about medications potentially to boost blood flow to the area and to just optimize your health overall. But having sex is really a great thing to do. If you enjoy having sex, have it whenever you want to. It's good to have blood flow to those areas anytime. It doesn't matter when, But generally speaking, if you're not having sex, don't catastrophize. Your body will be taking care of it for you.
Amazing. The human body never ceases to amaze me. That's crazy. Okay, one last question in this section before we move on to kind of dividing between males and females. Is there a difference? You kind of touched on it earlier. Is there a difference between sexual desire and sexual arousal?
Absolutely. So desire is the urge to have sex, right? It's something that is more brain related, right? It's that your brain sees something, wants something, feels the urge to have sex. Arousal is your body's physiologic response. So very often you'll have increased blood flow. You'll feel, in men, you'll get an erection. In women, you'll get maybe some increased lubrication. Their clitoris will tumesce. You may have other sensations like—
What is tumesce?
So just like a man gets erect, a clitoris gets erect too. So it'll get bigger and it'll get wider.
And I didn't know it had a word. Excuse me. Yeah,
that's okay. And then in terms of your nipples may get erect. So it's your body's physiologic response. And sometimes you'll be aroused and you might not feel desire, right? You might be watching something and you may not really think you're turned on, but then you're like, oh, I feel like I am, right? And that's just your body's physiologic response. It's not necessarily, they don't always happen together.
Is that like when a guy, I'll speak for all men across the world apparently, we just get random erections. We're not thinking about anything. We're not watching anything. It's just kind of, it just happens.
Yeah. Yeah. Especially when you're younger and your testosterone is really, really high and someone will just brush the area by accident and you'll get an erection, right? And that's completely normal. It's
you put on your pants.
Yeah. Anything, someone blew near there, okay. So yeah, I think it's very normal physiologic response. It's a sign that you're pretty healthy, right? If you're getting random erections, that's good. That means you've got all the machinery intact. It's all working well.
Okay. Follow-up question to that. And again, speaking, for men and women, if we notice the word again for women,
tumescence. You could just say, clitoral erections.
If our tumescence goes down in women and our erections go down for men in terms of just randomness and frequency, should we be paying attention to that as, this could be a decline in my blood flow and my overall sexual health?
Yeah, absolutely. So I think it's really important to pay attention to those things, because what we learn in training is like erectile dysfunction is the canary in the coal mine. So basically, when you start having blood flow issues, which cause erectile dysfunction, it could be a sign that later down the road, you're going to have heart issues. And the reason for this is because the blood vessels to the penis are about 1 to 2 millimeters, whereas the blood vessels to the heart are about 3 to 4 millimeters. Oh, wow. So you're going to see plaque buildup or problems with the blood vessels in your genitals long before you see it in your heart.
Wow, no way.
Yeah. So that's why I say people come in, they look healthy, they feel healthy, and they're having an ED. And I always tell them, check your cholesterol, let's check your hemoglobin A1C. Let's make sure that there's nothing hiding here, right? There's nothing else.
Is there any correlation you're aware of, or even causation from men, will say, that have suffered heart attacks to looking at their medical history and going, they all had erectile dysfunction, or whether or not that was a diagnosis or just reported, kind of personal reduction in erections?
So I believe the stat is that when men have ED, about 14% of them will end up having a heart attack within 7 years.
Wow, that's higher than I was expecting.
Yeah.
14%.
Yeah.
Within how many years?
7.
Guys, pay attention. Wow. Holy crap.
Yeah, it's real. So it's really important to not take it lightly in terms of just doing an investigation in your overall health. Even if you're not sexually active, even if you don't have a partner, like it is a sign that maybe something else is wrong. And it's a biomarker of health, right? Like this is our body telling us, hey, pay attention. Something's not right. I'm
so glad you said that. I've talked about sexual health as a very important other biomarker that a lot of people don't even consider. We get labs, we do strength tests and assessments, things like that. But, do you look at your sperm count, motility, fertility? Do you get a fertility test? Do you look at erection quality, frequency? For sexual health, reproduction is a huge biomarker that I think just gets glassed over.
Absolutely.
All right, so let's move on to women's health. What is the most common problem most females are currently experiencing, you think, or maybe even can kind of recollect in your clinic, when it comes to their sexual health? Yeah, so number one is low libido. So 40% of women will have low libido in their lifetime. 12% will be bothered by it. Now, bother, right? Some people may just like, I'm not that into it. It doesn't bother me, or it doesn't bother my partner. But 12% will be bothered by it. And this is based on validated questionnaire surveys that have looked at like rating libido, right? So it's a really common issue. And I think there's a lot of reasons for it. One is that we've glamorized in society what desire should look like. So it should be, hey, I see my partner, I'm turned on, I immediately want to have sex, we rip our clothes off, we have sex, right? But that's not the reality. The reality is a lot of people have what we call responsive desire. So it's like going to the gym. You go, you don't really want to go, but when you're there, you're really glad you did. Same thing. It's like, you're sort of like, I don't really necessarily feel like having sex, but once you're in the moment having sex with your partner who you love and enjoy, you're like, oh, this is great, right? Yeah. And so, but people feel like, oh no, I have to feel like the strong desire right away that tells me, oh, I got to have it right now, right? And that's just not reality. And responsive desire is very normal. It's just a matter of realizing that, you know what, like I have to be receptive or open to the possibility of having sex. And if I'm not in the mood once we start being intimate together, then fine, we don't have to, but at least being open and receptive to that and realizing that me having desire after being receptive is okay. That's completely normal and that I'm not broken. Those are some pretty wild stats. I wasn't expecting that high. That's pretty wild. When is the best time for a woman to have sex from an intimacy perspective?
I guess I don't really understand the question.
Okay, so kind of how we were talking about earlier, guys, we've learned that, we kind of go through this range of peaking and lowering testosterone, which drives erections, which probably is going to help you want to have sex or not have sex, morning, evening. Is there something like that for women?
It's the same for women. So women actually have more testosterone in their bodies than estrogen. And it is very much a hormone of desire for women as well. So very often, their testosterone will be highest in the morning, and that will be the time that their desire is the highest, usually. Now, not for everybody, but I think some of that is societal. They don't feel like they look the way they want to look, or they feel the way they want to feel in the morning necessarily. But I think that generally physiologically, we know that desire is probably most likely highest in the morning.
Interesting. Okay. All right. Good news, men and women out there. Do you think, or do you know, do women masturbate as much as men?
So the studies will say anywhere between 80% to 94% of women have masturbated in the last year. So probably most women are masturbating.
So I'm sorry, is that just saying that percentage of them have done it at least once in the last year, or what is that?
It depends on the study, but yes, they've participated in some form of masturbation in the last year. Now, we don't know how frequently that is. Some of the studies will be like in the last month, some of the studies will last in the last year, but we know a lot of people are masturbating, right? I can't tell you the exact number because there's not one.
We know a lot of people are masturbating. There's my clip.
Yeah, there you go. So yeah, I mean, a lot of women are participating in masturbation, and I think it's just less talked about in terms of women talking about masturbating, and also I think there's less education in terms of women like masturbating. Or how to masturbate, or what you can use to explore. If you don't talk about it with somebody, you may not know.
Would you say that it is healthy for a woman to masturbate? I
think it's healthy for everyone to masturbate. I think the reason being is that it allows you to really, it's the safest form of sex, right? You're not going to get anyone pregnant. You're not going to get STD. It's the safest form of a way for you to achieve pleasure. And we know that orgasms are really beneficial for health, right? We know that they improve stress. They help sleep. They help maybe reduce blood pressure and heart rate. So there's a lot of benefits to orgasms. But in terms of masturbation, the other benefit is that you learn what you like, right? You learn what turns you on. And so if you don't know what turns you on, you can't tell your partner what turns you on. So I think it's really important to take some time and explore with yourself and figure out what you enjoy, so that then when you're in a relationship with a partner, you can have you can show them, you can explain to them what you like, and you can then have a much more satisfying partnered relationship and sexual relationship with a partner, because there's a big myth, right? That all women need vaginal penetration to orgasm. And in fact, 80% of women climax through clitoral stimulation alone. And so if the partner doesn't know that because there's no sex education for young men, how would they know that, right? And women don't know how to communicate that, then there's a lot of women not having orgasms, right? And then they're not enjoying sex, and what's the big deal? Why is sex so great, right? Because they've never had an orgasm before.
Okay, so walk us through, again, speaking to and for women here, if they are not orgasming through masturbation or sexual intercourse or any other method, is that a bad thing? Is it just a matter of you just need to learn how to get there? Or is there more of a, hey, from a health perspective, if you are that sexually active and you're not orgasming, there's something going on?
So in terms of a health perspective, we don't know that it's necessarily a bad thing, but we do think that, is it because maybe they don't know how to, or is it because there's something wrong or whatever? We're not sure why, but we know 12% of women have never had an orgasm. So it's a pretty high number.
Wow. Geez,
yeah.
Okay.
So, it sort of takes some digging. It can be from a variety of different reasons. It can be because they're not stimulating correctly or appropriately. They're not, they have trauma or mental, psychological issues. And the brain is, what we say in sexual health is the brain is the most powerful organ for sex. Because if your brain's not in the right space because you're stressed, because you have trauma, because whatever
you're
reason,
checked out.
You're not going to orgasm. Yeah. You're just not, it's not going to happen. And so that's really an important thing to assess. There's a lot of factors that go into it. And so really kind of dissecting all those things. And then we have things that we can do to help women, figure out where the problem is. Maybe there's even a spinal issue. We don't know yet. There's some data that you can find Tarlov cysts or things in the spine that may be affecting the nerve function to the genitals. And it's pretty early data, but there are some, physicians in the US who are treating these things and looking and seeing and finding benefit through them, mostly in the pelvic pain area. But certainly we see that it correlates with better orgasms too. So I think there's definitely a variety of factors that it could be, but ultimately it's worth exploring. Everyone deserves to know what an orgasm feels like. So, if you are having trouble, go see someone. I think it's worth it.
Okay. To kind of wrap up this section here, follow up to that question. If a woman's listening right now and they are going, I've never had an orgasm, or I'm struggling to get them as often as I would like, kind of blanket statement here, what would you recommend a woman to do to try to help that? What would be kind of like, hey, if you struggle with orgasms in terms of not having them or not getting them as often as you would like, here's something you can try?
Yeah, so I would say one is definitely incorporate clitoral stimulation, use lubricant. So lubricant, the clitoris does not lubricate, right? So like while the vagina does, the clitoris doesn't. So sometimes you may need to try different lubricants. You can get over-the-counter sort of they're arousal gels that may help you feel that sensation a little more strongly. Not necessarily warming. They have I don't know exactly what's in them off the top of my head, but they do help some women, and you can buy them over the counter. And I would say test them on your skin elsewhere first. Make sure you're not sensitive, and start with small amounts. But certainly those things can help. And then, try to just take some time with yourself and experiment. Use vibration if you've never used it before. Vibration is a very powerful tool to achieve orgasm. And so you can go online and find a whole host of different options, read the Amazon reviews and pick something and try it out. You can.
Absolutely.
And so I would say that's a good place to start. And then, if you're frustrated, you're not figuring it out, then that may be time to see an expert.
Okay, thank you. Moving right along to men's health, and I'll preface this by saying I do have more questions prepared for men's health just because I am a guy. This is no shade to women by any means, but kind of a same question as we had in the women's section. What is the most common problem you see most males currently experiencing when it comes to their sexual health?
Erectile dysfunction, by far. And I think a lot of men are really surprised to hear this, but 52% of 50-year-olds are going to have problems with erections, 60% of 60-year-olds, 70% of 70-year-olds, and so on and so forth. So it's very, very common that a man is going to experience some challenges with erections in his lifetime. And it's very devastating and it's very stressful, but it is very, very common.
You said 50s, 60s. What about, is erectile dysfunction, does it need to be of concern for guys in their 40s, 30s, 20s?
Absolutely. It should. I mean, it does happen, if that's what you're asking. It does happen in terms of like we see younger men with ED, probably a little less often, maybe 20%, but still not an insignificant number. And then it's also how you define ED, right? So I think sometimes people are confused and they may ejaculate sooner than they want to and confuse that as erectile dysfunction. Sometimes
if you're ejaculating, you have an erection.
Yes, if that's premature ejaculation versus erectile dysfunction, because your erection's doing what it needs to do. You ejaculate, it goes away. That's normal. It's going through its normal arc, but it's just happening too soon.
So then define erectile dysfunction for us, please. What is it?
The inability to sustain an erection that is sufficient for vaginal intercourse. So if it's not hard enough that you can penetrate, it's, that's where we define it. Now, other things can be like you may have had one night where you didn't get an erection because you drank too much or because whatever, you weren't in the mood, your brain was not in the right place. And then it leads to this like very stress response, right? Like some people say you're only as good as your last erection, right? So guys are thinking about
Who says that? That's a terrible phrase.
No, meaning like that's how men feel. Not that people are saying that, but that's how people feel. Like, oh, my last erection sucked. So now I'm going to...
we're just going to compare it to that one for the next one.
Yes. And then I'm stressing, am I going to be able to get an erection? Is it going to last? Is it going to go away again? And then you can't get one because you're stressed. And then it just perpetuates. And that's what we call psychogenic ED or performance anxiety, right? But that becomes very common in younger age men because it's very, first of all, it's stressful enough as you're figuring out how to have intercourse. You're figuring out how to, navigate maybe using alcohol or other things, and you're meeting a lot of new partners potentially. And so all those things lead to a lot of stress and anxiety.
I've heard you talk about evidence-based ways to increase penile length. How?
So there are some studies looking at how to increase penile length. When you start with things that are to enhance the appearance of length. So everyone's penis is not just what you see. It goes deep into the pelvis, dives down into the perineum or that area right underneath the testicles. And so the erectile tissue is that long. It's pretty long. And so if you gain weight, it's going to look shorter. So that the fupa, people call it, right? That like fat above the pubic area, that is going to make your penis look shorter. So one easy thing is weight loss. And then also if you have a lot of pubic hair, shaving that can make it look bigger. So those are sort of easy things. Now, moving on to like actually increasing penile length, the one that, people have tried vacuum erection devices, and some people will say they definitely work, but there's no strong evidence to say that that's the case. So you've probably seen these penile vacuum devices online.
No, I have not.
You have not.
I have not.
You've never seen. Okay, you've never been targeted. Good for you.
I mean, is it what it sounds like?
So it's a vacuum erection device. Essentially, you put a cylinder on the penis. It creates a negative pressure. The penis increases, it gets an erection through that negative pressure, and then you can put a constriction band or a band at the base of the penis to maintain the erection. So it's used actually. It was created for men who had ED, and so they could use this to get erections. But people will make all sorts of claims that they're going to help increase length and increase girth. And at least in the data that we have, which is really small data, because this is not like it's more of a cosmetic and less of a medical need, has not shown to increase length. The next sort of over-the-counter thing you can get is a traction device. So a traction device is a device that essentially pulls the penis and it keeps it on traction for about, usually like 30 minutes or so. And that is over time. If you like dedicate yourself to that for several months, you will see a small increase in length. I mean, 2 centimeters, small, big, whatever you want to call it, but it is an
months
increase.
of penis pulling for
Correct.
maybe 2 centimeters
Correct.
increase of length.
Correct.
Personally speaking, the pros and cons don't seem to kind of check out there.
Yeah. I mean, I don't shame anyone who wants to do
Of course
this.
not.
Actually, small penis anxiety or like
your body do what you want.
The desire to have a longer penis is so common. It's like 55% of men feel like their penis is inadequate, and most of them have normal sized penises. So it's very, very common.
So it's not even just, sure, I wouldn't mind a bigger or longer penis. It's I actually feel that mine is inadequate.
Correct.
55%.
Yeah.
Come on, guys. Come on. Come on.
I mean, they may not admit that, right? But in a survey, that's what they wrote, right? At least in these studies.
But then you said most men are, statistically speaking, scientifically speaking, have an average size penis. And
yeah, especially the
average?
ones who are seeking to get a longer penis. Most of them have a normal or above average size penis.
What is normal or above average?
Normal is about 5.5 inches erect.
Okay.
So that's normal, and most people want more. And again, I don't shame anybody for wanting it. I just give the information in terms of like, what can you do? Now, there's other things like people will try to inject things into their penis to make it girthier. The only thing I would say is generally somewhat safe is hyaluronic acid fillers, like the same fillers women use under their eyes. There's different kinds of fillers, but essentially they've done some work with hyaluronic acid fillers, like doing very small amounts and doing it over time that can increase girth. There's not a ton of data yet, but there's a lot of people doing it in terms of practicing it clinically. But otherwise, there's lots of like permanent fillers. Those do tend to dissolve or absorb over 18 to 24 months. There are permanent fillers I would not recommend. There's also, so then there's surgeries, right? There's different types of surgeries that you can get done. There's not a lot of people doing them. They're not doing high volumes of them.
I wonder why.
So I would
not risk reward here.
Yeah, I would not generally recommend any sort of surgical correction at this time. If it was like a breast augmentation, people were doing it all over the country, I'd say absolutely. But when people are not doing a lot of it, it's not going to be they're not going to have enough experience to do it well necessarily. So I would generally avoid those things at this time.
Okay.
Yeah.
Solid advice. Can pornography cause erectile dysfunction?
Not pornography itself. So it's really in the mind of the user, right? So if you're watching pornography and you think it's bad and you think it's going to affect your erections. Again, it goes back to your brain is your most powerful tool. Now, in some cases, people will watch pornography and they will say, that's the only thing that turns me on, or that's what the kind of intercourse I want. And now these are all fantasies, right? Of what you watch in pornography. It's not real life. So then if you find yourself only being turned on by that, or you find yourself really wanting that fantasy, which can't be replicated necessarily in real life, then yeah, it may be hard for you to get aroused and hard for you to get an erection because you're not getting that, right?
That's more that mental barrier rather than the physical you're talking about.
Right. So it's not like it's changing your physiology.
Right,
it's changing how your brain interacts with with the world in terms of sex. And I think a lot of times the issue is that people see these things on pornography and they're like, why is my sex not like that? And it's a entertainment, right? Pornography is a product. It's edited. Like they have fake lubricant all over the place and they're doing things. And these guys are paid actors and actresses who have penises and vulvas that look like they do because they can't, right? That's how they get recruited partially to become one of these actors and actresses. So it's not like they're an average person. Yeah. And so it does create a lot of anxiety and a lot of, potential mismatch of like what turns you on and what is happening in real life. So when you find that it's detracting from your ability to enjoy sex with a person, then yeah, it's a problem, right? But if it's not and you're using it recreationally and it just is something to give you pleasure for a short period of time and you can separate that from reality, that's great. That's fine.
Okay.
Yeah.
All right. How can men increase semen volume and why does this matter? Is more better?
Yeah. So a lot of people love to talk about this. And I would say that more is not necessarily better. The average amount of semen volume is 5 milliliters. So it's like a teaspoon, right? It's not a lot. And more doesn't mean that you have more sperm necessarily.
Right.
So
semen is not the same thing as sperm.
Correct.
Right.
Correct. So if you were saying like health-wise, is it better? Not necessarily, right? Now, some people really enjoy the feeling of having a large ejaculate volume. It's more pleasurable to them. But interesting, when you look at the female partners, and again, there's not any, this is only heterosexual data, but if you look at the female partners and you ask them, there's actually a study that's been done on like, do you prefer more semen volume or do you prefer, does it make a difference? And really the only thing that makes a difference is that their partner ejaculates or not. So
the amount really does not influence the female perspective.
Correct. I mean, some women will say, of course, that they like it, they feel it, it's good, but that's not, at least in that one study, that was not necessarily an issue for most women. Like, yes, there are some, of course, who really do enjoy the volume, but the large majority, no. The large majority just want to make sure their partner's ejaculating and feeling pleasure and that they're enjoying themselves, right?
Yeah.
In terms of how can you increase it? Well, one simple thing, increase your fluid intake. So
fluid across the board.
Yeah, fluid across the board.
Cheers.
So fluid across the board will increase semen volume and also abstinence between ejaculations.
How long?
So generally, when you look at the data, you will see an increase in volume, but at some point over many, many days, but at some point the quality of the sperm, so if you're trying to conceive, actually goes down. So generally we say at least 48 hours if you want to really increase semen volume. But yeah, if you go longer, you might have more, but at some point you get diminishing returns. So probably after about 5 days, you're getting diminishing returns.
Okay.
So that's another way. Also, if you want to just increase the force at which your ejaculate comes out, so it appears more voluminous, that you can do by doing Kegel exercises. So
and guys can do Kegels.
Guys can do Kegels.
Yeah.
So I will caution you to say that not everyone should do Kegels, and I'll talk about that. But Kegel exercises are exercises where you essentially strengthen the pelvic floor. So for men, how do you do them? So in men, it's like when you're peeing and you try to stop the flow of urine, that's actually your strength. You're squeezing those muscles. Now, I don't want you to do them every time you pee because you'll create a problem.
I was just going to say, like, what's the frequency here?
But so then the other thing I tell people, sometimes it's like you're lifting your penis without touching it. So that's also squeezing those muscles.
I mean, by like, sorry, I'm a visual learner here.
Yeah.
Well, just by cupping?
No,
like,
without your hands.
Oh, without your hands.
Yeah,
Oh.
so you're trying to without your hands.
Interesting.
So, or you're trying to hold in a fart. So those are sort of like different ways that you can, those are, visualizations you can have to help you squeeze those muscles. And then, but you squeeze and you relax. So 10 seconds squeeze, 10 seconds relax. And the relax is really important because you don't want those muscles to clench up and get tight. And that's why I say it's not always good for everybody because some people have a naturally clenched state, right? Their pelvic floor is naturally tense. Maybe they're type A personalities. Maybe they've had some trauma. Maybe they had some surgery, whatever it is.
High chronic stress.
Yeah. And they can, just like people get TMJ, their pelvic floors can get tense. And so in those cases, sometimes when you do Kegels, you make it worse. So So you might start noticing, hey, my erections are not as strong, or hey, it hurts when I orgasm, or hey, I'm getting constipated, or maybe I have to go to the bathroom a lot more often than usual, like urinate. And so it presents differently in every single person, but can be a sign that your pelvic floor is tense. And so learning how to relax that pelvic floor in those cases is better rather than doing Kegel exercises.
Okay, so if that's us, what is the anti-Kegel we should be doing?
Yeah, so one, I always recommend seeing a board certified or specialist pelvic floor physical therapist, because they'll work with you on finding the exercises that are going to work best for you. But ones that I generally tell people that will be helpful are certain yoga poses can be really good at sort of lengthening the muscles.
Really? Like what?
Like happy baby pose and child's pose, and then like the low, deep squat. Those all will sort of help lengthen and stretch those muscles. And then diaphragmatic breathing. So breathing in the belly rather than the chest. All those things are going to help sort of relax those muscles.
Amazing. This is why all of this has been so educational and mind-blowing in some capacities. And this is why I love talking with experts like yourself, because it's such a great reminder of when we're looking through the lens of a particular thing in the human experience. I mean, we've been talking about sexual health. There are certain things that we can do to try, or we have clinical evidence to prove that works for this reason, but also just in general, it's good for the body. And I'm thinking, knock on wood, I'm pushing 40, and I know some other guys around my age-ish, and we have different sexual health levels. I'll say that in terms of erection frequency, quality, sperm count. I mean, all the things we've been talking about. And I think to everything you just talked about, I do deep squats, I do happy baby, I do yoga, all the things you've been talking about for other purposes for my personal wellness journey feed into kind of the collective picture, but also, okay, maybe this is why. I've been doing a lot of these other things, and I know a lot of other guys don't, or at the frequency that I do. And so it's great to know that while it's serving my other personal wellness goals, it's also supporting my sexual health, reproductive health at the same time.
Yeah, and anything generally that's going to reduce stress, right? I'm sure you're doing it for stress reduction partially. And so like anything that's going to reduce stress is going to help you, because stress is a libido killer, it's an erection killer, it's all those things. And so you got to reduce stress. And we live in a very high stress life right now, right? Like everyone is trying to keep up with the Joneses and working, 10-hour, 20-hour days, like not sleeping. And so,
trying to keep it up with the Joneses.
So, I think it's important to realize, like, you'll watch and learn a lot of different things on social media these days, and that stress is not helping you, right? Like, I'm doing this wrong. Oh, shoot, I was doing that. And, like all that stress is not helping,
Yeah. So those are my little just personal testament there. I've also heard you talk about this, semen retention. What is that?
So semen retention is the act of not ejaculating for periods of time. And so it became popular in No Nut November. Actually, No Nut November, I think, started as a meme I learned recently. And it wasn't like a joke.
Like all good things in the world starts as a meme.
And then people began to extrapolate from Taoist literature and say semen retention is good for you. And then now it's sort of, people are very interested in this. And I would say that I don't think there's anything wrong with semen retention, but I do think that it's not necessary. And there's no evidence, no strong evidence, like one small study of like 10 guys. There's no strong evidence that it has any physiologic benefits in terms of increasing testosterone. But certainly people do report that they feel mental clarity or whatever. And that's fine, because maybe for them, it allows them to focus on something outside of masturbating or ejaculating. And maybe that was detracting from other things in their lives, but it's not going to make you superhuman. It's not going to make you boost your testosterone to wild numbers. And I think the reason I say this is because I see the opposite. Men are abstaining so much that they're clenching their pelvic floor so tightly, and then they're creating all these other problems, right? Man. And then honestly, your body will take care of it itself. So if you don't ejaculate, either your body's going to absorb that, or you're going to have a nocturnal emission. You're going to have a wet dream. And then you feel like you failed because your body did something you had no control over. Wow. So, I think there's a lot of shame and a lot of potential harm if someone's forcing themselves to do something because of some theoretical benefit. And if they're not seeing the benefit, then there's no point in hurting yourself.
You said the body will absorb it. And I've within kind of the semen retention ecosystem, I read a book earlier this year called The Way of the Superior Man. And in that book, it's kind of it's a unique
I hate
men's.
that title, by the way. Like, why are we calling men superior to other men?
Fair point.
You know?
Fair point. And, I definitely, without going too deep, I enjoyed some of the writings. I forget the author's name now, but I enjoy some of the writings. Others where I'm like, this is just kind of too hardcore male, typical archetype stuff. But in that, he talks a lot about your semen, your ejaculate, having sex, whether with a partner or yourself, kind of letting go of your life force. And he talks about, there's a term for this, and I'm brain farting right now, I'm going blank on it, but basically, I get edging, basically. And we actually had a guest in here a couple months ago talking about this as well. And, using that as a way to kind of like enhance sexual arousal and performance and kind of just also control life force. And they both mentioned about how it can, instead of you ejaculating, it goes back into your body. How does that happen? What's going on there? Yeah,
so there's a couple things. Sometimes they'll use a little pressure on the perineum. So if you look at like meditation, sort of the school of meditation where they use semen retention, they'll actually like push their heel into their perineum. And what that's doing is it's preventing the ejaculate from coming out. So then it'll go back into the bladder and then you'll pee it out later, right? So when the ejaculate comes out of the urethra, it has one of two ways to go. It's either going to come out or go backwards. Now our body closes the bladder neck so that it can't go into the bladder. But if you're on certain medications, like for your prostate, sometimes that relaxes and then you will have lower ejaculate volume because it'll go backwards instead of forward. So one is that. So you may be inducing like retrograde ejaculation. The other thing is your body will so the ejaculate's made up of different things. It's made up of your sperm and seminal fluid and prostatic fluid. And so your body will just resorb and create more if you're not using it. It'll just resorb it. Just like, every day in our bellies, we're making fluid. It's called perineal fluid and our body just resorbs it. And, you have lymphatics and all these other things in your body, right? Yeah. So your body's constantly taking care of all these fluids in your body and resorbing and you're going through your kidneys and then peeing it out. So really, if you don't do it, your body will take care of it for you.
So is that a matter of, does the same process happen by a man retaining from ejaculating up to a certain point? We build up that fluid and semen and our body just does.
Come out. And then really you're actually ejaculating, you're just ejaculating in a different direction, right? But I will share one thing that there is some data that ejaculating more often or 21 times a month, which is the number they used, and that this is not a magical number, it's just a statistical number, right? They came up with this number based on the normal distribution of men in the study, but they found that men who ejaculated 21 times or more a month were less likely to develop prostate cancer. And so we don't know why that is. It may be
That's kind of a lot.
It's a lot. It's a lot. But I think it's just that, I think it's the idea that you're, routinely clearing out some of these fluids potentially, that maybe you're getting rid of some inflammation or things like that when you ejaculate. Now, we don't know for sure, right? This is not my prescription to say everyone should ejaculate.
Yeah, was that like an average of the study? And men who on average ejaculated this much didn't have the problem? Or did they run through
they looked at,
hard numbers?
It was categories. So it was like less than 4 to 7, 7 to 11, I don't know, whatever.
Was this all self-reported, do you know?
It was, I forget the exact thing. I think it was through a survey and they self-reported how many times they thought they were masturbating. And then not masturbating, but ejaculating. So it could be through sex or masturbation. Right. And so they compared 4 to 7 times versus when they looked at the data, 4 to 7. They did do a very good job of trying to control for other factors, but there's always going to be factors like maybe the person having that much sex and masturbating that much is healthier than the person who's doing less, right? So they did try to control for all those things, but I think it just goes to say that it's certainly not bad, right? I use that data to say like masturbation is not bad for you. It's not creating a problem in terms of your prostate or other things.
That seems like such a big gap. 4 to 7, and then there's nothing in between all the way until 21 or more.
Meaning that there was no statistical finding.
Gotcha. Okay. Okay. So no statistical significance.
Correct.
Okay. Interesting. Always look at the sample size. Always look at the statistical significance, fam. Okay.
And is it clinically significant?
Yes.
That's another big thing.
Yeah. What are the best foods or supplements for increasing erections in terms of firmness, size, erection duration, et cetera?
Yeah, so I think we talked about some of them. Watermelon is a great food because of the citrulline content in watermelon. I would say that L-citrulline and L-arginine are good supplements in terms of increasing blood flow to the penis, increasing nitric oxide. And I would say that generally, it's not going to work for everybody. So I just say, I've said this earlier in the podcast, but supplements do have data. It's not as rigorous as the data is on like sildenafil or tadalafil, but there is some data. It is positive for those supplements. And there's quite a few, at least in L-arginine, there's actually quite a few studies on it. L-arginine is just not as bioavailable. That's why I recommend L-citrulline. It's easier to take because it's twice a day versus 3 times a day or 4 times a day for L-arginine. And so, I think if you want to try a supplement, I would start there. And then food wise, a heart healthy diet is whatever's good for your heart is going to be good for your penis. Okay. So you want to avoid processed foods as much as possible. You want to increase protein intake. You want to increase antioxidants. So like, berries and vegetables and generally the Mediterranean diet, and keep healthy fats. But not, don't want to be too low fat, don't want to be eating saturated and unhealthy fats. So just generally speaking, the data is best on Mediterranean diet, but I would extrapolate that, things we know that apply are sort of the things that I mentioned already.
Yeah, and you kind of touched on it there, but follow-up question would be, are there foods that men should absolutely avoid in terms of decreasing erection quality?
Yeah, so anything like fried foods, you want to avoid a lot of unhealthy fats, trans fats. You want to avoid, really, those are the big ones. I would say that there's no there's some data that maybe plant-based is better, but it's really small. So I just tell people, generally speaking, let's stick with the data we know. And that's, quit smoking. That's the number one thing I would say. If you're smoking, none of this matters because you're going to have erection problems. So quit smoking. That's going to kill the health of your blood vessels and then kill your erections. So I'd say before you change your diet, stop that first.
This just in. Ditching the ultra-processed foods and smoking is good for your health. Who'd have thought? I love we can just boil it down. It really, for sexual health, but also just health in general, it really can be boiled down to that just simple statement.
Yeah. And I think it stresses people out when you tell them you can only eat this or don't eat that, or, just do your best 80% of the time. And then, if you 4 days a month eat something bad, don't kill yourself over it. But really just try to do your best as much as possible and focus on investing in your body.
Yeah. Would it behoove men to know if they have a female partner, to know their female partner's cycle, to enhance their chances of having sex? Are there some days that are for sure a no in the cycle and others are for sure, or maybe even just a strong maybe?
Yeah, so we know that around ovulation, generally speaking, women are there because if you look at the way the hormones cycle through the body, they're at their peak. And so in those cases, there's more libido potentially around, there's more interest in sex. And so that's probably the best time. In terms of, I think low times, if they're menstruating and they're not feeling great and their hormones are bottoming, at that point, they're not going to be really interested at that point.
Should every man be having morning erections? I want to just kind of blatantly ask that question. I know we kind of touched on it, but what does it mean if they're not? And I've also heard you talk about the importance and difference between daytime and evening directions. What's the difference there?
Yeah, so you should absolutely be having morning erections. You should absolutely be having erections overnight. That is a sign that your body has good blood flow, good nerve function, good hormones, right? It's telling you, your body's telling you, yes, everything's working in good working order. So if you're not having those, there's a problem in one of those areas. So you need to get worked up and evaluated. And I tell people to be proactive, right? Like you don't want to wait till you're having problems with erections when you're having sex. If you're seeing problems, like let's deal with it now. Let's fix the problem before you get there rather than waiting for it to be like, oh man, I haven't had erections in years. And let me tell you, I see those patients too. And it's really sad that they've waited that long to come in and see somebody.
Because I'm hearing that this stuff, if we're aware of it early, we can really get ahead of it in big, big ways.
Yeah, and I get it. It's really stressful, right? To be like, something might be wrong with my genitals. Like that's a big, scary thought. And it's really hard to come and see someone about that. But again, it's investing in your health. And so I think you're helping future you. And that's the way I sort of like to look at my life. Like I'm always trying to help future me, help my future patients, help, things in the future.
I say that all the time to myself. I'm like, what would a future Chase be really grateful for that present Chase is going to do or not do right now? Or the opposite, when I'm just living in the moment, usually like a YOLO, like, man, future Chase is going to be pissed. That's a problem for future Chase. He'll figure it out.
Yes, that's a problem for future.
Future Chase always figures it out because present Chase is here.
Yes.
How much of a man's virility in terms of erection and overall arousal, frequency, quality, et cetera, is physiological versus psychological?
I would say you can't have one without the other.
Ooh, okay.
So if you are not in the right mind space, if you're stressed, if you're anxious, if you're thinking about your erection rather than actually being in the moment with your partner or with yourself, whatever it is, like you're not going to have an erection. You're not going to have the physiologic workings because your brain is going to stop them. So I tell all my patients, even if you have the worst health because you got bad genes or you have bad diabetes or bad high blood pressure or bad cholesterol, and your erections are 100% due to vascular problems, you still have a psychological problem because you are stressed about it. You are thinking about it. You are worried about it. And that comes with you every time you try to have sex. Every time you try to fix this problem, you are thinking about it and you are stressed. So you just can't have one without the other.
So well said. And when you really think about it, when you walk into the bedroom or you walk into wherever you're having, your sex life, you bring all that with you.
Yeah.
You bring all the day's stressors and worries and woes and accomplishments, but especially if this is top of mind or you're just thinking about it, like you said earlier, you're only as good as your last erection or, you're worried about your health in any capacity. Yeah. How can you truly fully be present with yourself or your partner? And it kind of just becomes this downward spiral.
And just to be clear, you are not only as good as your last erection. I want to be very clear. I think
she was referencing somebody else.
Yeah, I was saying that people often think that way, but it is not true. You are much more than that, much more.
I have one more question here in men's health before we move on to kind of the couples health, a few questions. Do men need to ejaculate in order to orgasm?
No, you can orgasm without ejaculation.
Walk us through that. What is it? Because I think most guys think a male orgasm means ejaculating.
So an orgasm, in essence, is a release of buildup of tension, right? And so very often they're together, right? Because you, as a man, you will know this, but physiologically what happens is you're building, you get to a point of inevitability, right? Where you're like, I'm going to ejaculate. It's going to happen, right? And if you can learn to recognize that point and sort of like edging, right? You can then orgasm, but not ejaculate. And so, yes, you can train yourself to do that. Do I think there's value to it? Maybe, maybe not, right? It depends on what you're into. Some people will do that and then they'll actually feel like their orgasm's less strong, right? Because they've coupled those two together.
Yeah, I could see that.
But sometimes you'll feel like it's even stronger. So I think it just depends. And ultimately, it may make that final orgasm when you do ejaculate more stronger. So I think it just depends. So yes, you can. And the other thing that people don't realize is you can have an orgasm without an erection. So oftentimes, when men do go through erectile dysfunction, they feel like, well, my life is over. And yeah, it's not ideal. It's not ideal, but you can still have pleasure and your partner can still have pleasure because you don't need an erection to stimulate the clitoris and they don't need an erection to have an orgasm. So you can still have pleasure and you can still enjoy each other. And so if you're at that point and you're like, I don't want to do anything else. Like, I just want to make sure my partner's happy and make sure I'm happy. There's plenty of ways to do that.
I like that little last bit there. That's interesting. Okay, so let's move on to the couples health. And same question we've talked about for men and women, but for couples, what do you think, or what do you know, what do you see is the biggest problem facing most couples today when it comes to their sexual health?
They don't talk.
They don't talk.
They don't talk about sex. And it's not their fault. No one taught us how to talk about sex. I'm sure you didn't talk to your parents about sex. I didn't talk to my parents about sex, not in any meaningful way. And so I think, and school didn't teach us how to talk about sex. So it's like super awkward.
I
right?
went to a very small private Christian school growing up. So you can imagine there was like no one talking about it and then us below that.
So yeah, it's not anyone's fault, but we don't know how. And how do you bring it up? And it's very emotionally charged. I think people forget that sex is supposed to be play. It's supposed to be fun, right? Yeah. And so like, if you bring something up, like it's not an emotional thing. We're not trying to make you feel bad. No one's trying to make their partner feel bad. They just want to maybe talk about it, but realizing that it's not going to take just one conversation. You have to start having awkward conversations so that eventually you can have really good conversations. And so it's sort of investing in the time to talk about it and then saying, okay, this wasn't great. Let's revisit it again. Let's try it again. And let's keep trying to talk about it until we're at a place where like, hey, you know what? I don't love it when you do this, but I love it when you do this. And then that's where you start, oh, really? Well, then I'll do more of that. Yeah. And like, that's where you really start getting to this amazing, mind-blowing, kind of sex that you're having. And then sometimes it's like, it's okay to have mediocre sex too. I think sometimes people are like, every time we have sex, it should be mind-blowing. It's like, it's not going to happen, right? Especially as you get more and more responsibilities. Your kid might be in the room next door, or your dog might jump on your bed, whatever it is, right? And so it's okay to sometimes have average sex, but like, also just making sure that you're constantly trying to check in and make sure your partner's happy and you're happy. And how can you change it up, right? Yeah. How can you spice it up and do something new or novel?
Yeah, to your point earlier, the working out analogy, personally speaking, I will take having a mediocre workout today versus not having any kind of workout or physical activity. Yeah. And I will also say I take mediocre sex over not. Most days, I think. Some days I'm definitely just too tired. But total honesty here. Yeah. But yeah, it's such a good point.
Yeah, absolutely.
Can couples use pornography to their advantage?
Absolutely. So one, you can watch it together to get aroused and get in the mood. Two, you can watch it to get ideas. Like, hey, and then you're watching like, hey, would you want to try that? And be like, yeah, I don't know. And, plant the seed of something you may fantasize about. And of course, always, I think when you're introducing new things to your relationship, like have boundaries around it, have safe words, make sure that you're both on board, check in with each other. And if you feel uncomfortable saying the words, it can be as simple as a nonverbal, like, okay, if I push you like this, that means I don't like it. Or like, but
I like that. Yeah.
Because a lot of communication in the bedroom is nonverbal, right? So it could be just moving someone's hand or moving someone's mouth or whatever it is, right? And that's okay. Like that's not a bad thing. That's a great way to communicate.
And also, preface it, communicate about it ahead of time. Maybe not springing,
not
springing
in the
some
moment.
Extracurricular activities on them in there. Yeah.
Yeah. Don't talk about it in the bedroom. So I always say, have your sex conversations not right before or right after sex.
How do you get what you want in bed?
You ask for it. You ask for it and you practice. So just like any skill, you're not going to be good at it right away. You have to practice. So if you want to have great sex, you keep having sex with your partner and you learn what is good, what's not good. And in particular with sex, you got to keep it interesting because just like you don't want to eat the same food every day, you don't want to have sex the same way
Unless
every day.
Pizza. Pizza's fine with me every day.
Sure.
Yeah.
Even pizza gets old if you're doing it every day.
No, never.
Yeah.
No.
Well, generally speaking, I would say like, you got to work at it. Just like you work at any other skill. If you want to have great sex, you got to talk, you got to act, and you got to do.
Okay. All right. Might be TMI. My wife might kill me here, but I'm going to ask anyway.
Yeah.
This is a safe space. Sex during pregnancy. Pros, cons. Should we be having sex during pregnancy? Are there any risks? I've heard on kind of like the far end, if you're struggling to induce labor, I've heard having sex can help that. But what about sex during pregnancy?
So sex during pregnancy is totally fine unless your OB says for some reason you can't. So there are some conditions where, if you have placenta, a certain position where it may be dangerous, but that's exceedingly rare.
Okay.
And so you'll know, like your OB will tell you. And honestly, if you're a woman who's pregnant, ask your OB and ask them, well, what about masturbation? Is orgasm okay? Or is it just the act of the penis going in the vagina? Because orgasms will cause some uterine contractions. That's where we think it may cause labor. So, if you're in that situation, ask. But most of the time, it's totally fine to have sex. Sometimes you got to be creative with positioning because some things can be uncomfortable, but absolutely totally safe and nothing to worry about. There's a lot of men who will worry that they're going to dent the baby's going to have dimples.
Yeah, let's go back to the previous statement about the average male penis length with 5 inches erect. Okay, guys. Calm down.
It's not reaching. It's barely reaching the cervix. It's not reaching the baby. So you are fine. You're totally fine. And sex actually, because of all the hormones, can be even more pleasurable for the female partner when in the right position. So absolutely have sex. Enjoy. Okay. There's no reason not to.
Okay, kind of getting towards the end here. This has been so educational, informative, and fun. Thank you so much. What about painful sex? Should one continue to try and please their partner if they're experiencing pain during sex? I guess I should say during intercourse, or even just, I don't know, maybe a guy has a painful erection. And what are key symptoms to take note of that there may be a bigger issue versus just a one-off experience of, that didn't feel so good?
Yeah, so sex should never be painful. It should never be painful. And so if you're having pain with sex, it's important to think about what's going on. Has it always been painful during sex? Is it something new? Is it certain positions? Because the most common thing, there's a few easy things you can do. One is adding lubricant. So it'll just make things slide a little more comfortably. And then the kind of lubricant you use can make a difference. So water-based lubricants, or aloe-based, those are the same kind of lubricant. They're usually the cheaper ones. They're usually available everywhere. Those will dry up. So if you're having sex for 10 minutes or whatever, you may need to reapply. And so, you might feel good in the beginning and then it's sort of gone. Yeah. And then also if you're using condoms, that can make it a little bit more uncomfortable. So using lubricant, I think a lot of young people feel like they don't need that, but why not? It's just going to make things more fun, more comfortable. Two, if sometimes there are women who are sensitive in the cervix, and if you're with a very well-endowed partner, you can buy things to make space between your body and the length of the penis. It's called O-Nut. I'm not sponsored by them at all.
Oh, wow.
But there's actually a thing
you can padding or something?
It's just like a round. It almost looks like a donut that you put on the penis, so that
like a spacer.
Yeah, like a spacer. So a shorter insertive length. So that may be helpful. But then if you're still having pain, it's really important to get evaluated because it could be pelvic floor dysfunction, which can be managed with pelvic floor physical therapy. It could be something else, like you have an anatomic abnormality that you wouldn't know. I encourage all women to take a mirror and look down there, actually look, because you should know what your vulva looks like and what your anatomy looks like. But then also if there's something abnormal, you'll be able to tell your doctor, hey, I saw this thing and this wasn't there before. And so that may be part of it. Sometimes people have cysts called urethral diverticulum that can cause pain with sex. Sometimes it can be the uterus is, endometriosis or things like that can cause pain with sex. So ultimately getting evaluated, because it could be correctable. Very likely it is correctable. And so don't suffer in silence, get it taken care of.
So getting towards the end, you've dropped so much wisdom and information. Again, thank you. And I know this is your profession and what you talk about online and on so many podcasts. What is maybe a question or two that you have not been asked or you feel absolutely people still need to know that you have not talked about, or at least not here today?
Yeah, I think the other part of what I do very often is bladder health. And I think a lot of times we don't talk about it. And it's so important because it's one of those things where until you have a problem, you don't even think about it. But if you're struggling with leakage with urine, or you're going a lot to the bathroom, or you're waking up a lot at night, you don't have to live like that.
What's a lot?
So during the day, if you're going more than 8 times a day, if you're waking up more than once at night, if you're having urge to go, everyone has urge to go, but it's so strong that you can't delay it. You're rushing every time to the bathroom.
This is just urinating?
Yeah.
Okay.
Yeah.
Right. You said bladder. Yeah.
Bladder, yeah. And if you're leaking, right? Those are all things that we can help with, and
male or female,
and you don't have to live with it. I think a lot, especially in the female population, a lot of women think, well, I leak a little when I jump on the trampoline or when I cough or sneeze, and I've had a couple babies. That's normal. It's not normal. You can live with it. It's not none of that is dangerous. None of those things are dangerous for the large majority of people. There's rare occurrences where it could be a sign of something else, but most of the time it's not dangerous. It's quality of of life, but your quality of life matters. And like, if you're going to the bathroom 10 times during your work day and you're not able to work, or you're spending money on products because you're leaking, like those are not things you have to live with. And we have pretty simple things that can help.
No, I'm sure that means if you're just going about your day, air quote here, normally, I think I drink a lot of fluids. I drink a lot of water. I love tasty beverages, shout out Element. And I probably go to the bathroom. I urinate 10, 12 times a day.
Yeah.
But I'm always hydrating.
Yeah. So, I mean, I think so you have to take those things into consideration. If it's not bothering you and you're going 10, 12 times a day, I don't care.
Okay.
But if it's bothering you and you're drinking a normal amount, or you can even, what I tell people is you can write down how much you're drinking, and you can even like guesstimate how much. You can buy a hat to see how much, or you can just guesstimate how much you're peeing, like how long your stream is. And then you can see, like, does it make sense? Like, am I making the same amount as I'm actually drinking? And then you're like, okay, well, maybe I got to drink less, right?
Okay.
So that's one easy thing, but there's also certain things that can irritate the bladder. So caffeine, sometimes artificial sweeteners, spicy foods, citrusy fruits and juices sometimes. So for some people, it's as simple as like, hey, I got to cut off. Like some people are drinking 6 cups of coffee a day. Like maybe go down to 3 and you'll be okay.
Trust me, the rest of your life will thank you for it. Yeah.
Right. So like, I think sometimes it's as simple as that, but sometimes it's a real problem and you need a little more help. And we have a lot of things like medications and procedures that can help and can give you back your quality of life. And until you have seen what that's like, you're like, oh, I didn't know what I was missing sometimes. Or like, I just lived with this I think a lot of people live with those issues for years and years and don't do anything about it.
Yeah. Okay. Yeah. I had just another question pop to mind. It fleeted me, but I want to ask one other question. On the horizon, again, you are a practicing physician. You speak about this. You practice it every day. Is there something on the horizon that we should be excited about in terms of urology, sexual health? Because I'm sure you have like do the conferences and the CEMs or CMEs and all that stuff. What's on the horizon?
So a couple things. I think for erectile dysfunction, there's a couple things. I mean, shockwave is around. It's definitely relatively new in the sexual health space, but shockwave is essentially a device that produces acoustic sound waves and causes to the penis directly, and it causes mechanical trauma. And that mechanical trauma tells our body to send in growth factors to create new blood vessels.
No way, really?
Yeah. And so shockwave is something that is not currently in the guidelines for ED. I think it will be. It's got about 10 years of data, and it's specifically focused shockwave. So you have to sort of differentiate. There's different kinds of shockwave. There's ones you can buy at home, and there's ones you can get that are cheaper. Those are usually radial, and they're not getting the depth of penetration that you need. But the focused shockwave, that's our first sort of foray into regenerative medicine for sexual medicine. And I think that's pretty exciting. Okay. There's other things out there that have less robust data, like PRP shots and stem cells. The data's not strong enough yet. Maybe it will be, but not yet in my mind. And then there's also Botox, which is new. There's been a few studies on Botox for erectile dysfunction.
Really, Botox to the penis?
Correct. And it causes essentially smooth muscle relaxation.
Okay.
Which allows it to be easier to blood to flow in. And it may increase length by, half a centimeter or so, because it's also causing that smooth muscle relaxation. And so that, I like that data because they did it on men who had really severe ED. So by the time they got it, they were about to have surgery. They were about to have implant surgery for their penis. They got the Botox, and they were able to then go back and take medications instead of having surgery. So that's the reason I thought that data was really interesting.
Anytime you can thwart surgery, right? That's amazing.
So I've been able to do it on a few patients who really liked it, and I think that's sort of exciting. On the female side, and actually I guess both female and male, for overactive bladder, there's a whole bunch of new devices coming out to help with overactive bladder that are sort of doing neuromodulation. So changing stimulating the nerve signals to the bladder so that it functions more normally. And so that's kind of exciting. There's There's different devices you could implant in the ankle that stimulate a nerve in the ankle that goes up to the bladder. That
Really?
Yeah. So that's sort of exciting. And I think the more we have options for our patients, the better. Right now, the options are Botox to the bladder. There's a bladder pacemaker, which is the same sort of technology, neuromodulation, but it's to the bladder nerve root. And then there's acupuncture type stimulation to the ankle. But now we're getting implanted devices to the ankle too. So there's just more options.
Amazing.
So I think there's a lot going on, and I think it's really exciting because people are really trying to find new ways to improve people's quality of life in an area that's desperately needed.
All right, I have one other question before my final here, and I'm trying to think of the best way to kind of phrase this. I've talked about this on the show and very public about different modalities that I personally use and have found a lot of health benefits from, but also recreational. I've gone through a couple of years now of ketamine-assisted psychotherapy, ketamine therapy for PTSD and mental health, psilocybin, and MDMA. And I have noticed beyond kind of alleviating those symptoms, particularly PTSD and a lot of stress and anxiety and unwanted mental health things, I've also personally noticed, and even through such things as like holotropic breath work. So I'll say altered states of consciousness through substances and even just breathing differently has dramatically changed my, I'll just say, I guess, libido or kind of approach to my sexual health in a positive way that I was not expecting and like no one told me about in terms of just overall increased libido. And I have never had an issue with libido, knock on wood. And so it's just gone from really good to like, whoa. And have you heard anything about this? Is it more like, again, physiological or psychological kind of stuff? Yeah,
I don't know any data on that as of yet, but I would venture to guess that if your stress levels are decreased because of it, which I assume they are,
that's what I'm kind of thinking.
That you're having more libido, and so you're gonna feel, you're gonna have more availability to. So when you think about the brain, there's pro-erotic hormones, and there's ones that sort of try to dampen your desire. And so depending on that balance, this is probably increasing the balance of those pro-erotogenic hormones that are going to give you more desire, probably through some mechanism of how it's affecting your brain, would be my guess.
Okay. Yeah. So bottom line, if you do things in a safe way to lower stress in your life, good.
That's why people talk about supplements like ashwagandha, because it's
daily user love it.
It reduces cortisol, it reduces stress, and so that's probably why we're seeing improvement in erections with that medication.
And for a lot of guys, I've seen a lot of anecdotal and clinical evidence. It's pretty small clinically, but ashwagandha for helping increase testosterone works well. I personally just love it from the adaptogenic aspect. Okay, great. Thanks so much. All right, last question. This has been, again, such a treat. This show is meant to help people bring heightened attention and awareness to key areas in their life to move them forward and to keep living a life ever forward. Those two words, what do they mean to you here today?
I think it is, again, thinking about future you and trying to do things to make future you the best you that you can be.
No right or wrong answer. I always appreciate everyone's interpretation. Where can my audience go to connect with you more? We're going to have all of your information in the show notes, the YouTube video.
Absolutely. So I will, you can find me on my podcast, Rena Malik MD podcast, as well as my YouTube channel, which is Rena Malik MD. I'm also on all the social media platforms, but those are probably my two active ones. Yeah, guys, seriously, if you have found any value out of this episode today, just do a deep dive in her stuff. I love your podcast because you do like little chunks. I try to pick one little topic and you go deep, hard, and fast for a couple minutes, and it's just boom, you got the information. I love it. It's no BS, very informative, very helpful, and you're so good at it. So I love it. Yeah. Thank you so much. Amazing. Thank you guys so much for watching, listening. Make sure to smash the thumbs up button, subscribe on YouTube, tell your friends, go back, take notes. I know I got more notes on notes on notes here. This has been a pleasure. Thank you. Thank you. All right.